Evaluation according to nursing education. Evaluation according to nursing education. Evaluation in nursing education. Evaluation in nursing education is a systematic, continuous, and objective process of collecting, analyzing, and interpreting information to determine the extent to which learning objectives are achieved by nursing students. It is used to judge the effectiveness of teaching learning activities, student performance, and curriculum outcomes. Evaluation is the process of measuring the value or worth of students' knowledge, skills, attitudes, and clinical performance in relation to predefined educational objectives. Purposes of evaluation in nursing education: to determine achievement of learning outcomes, to assess cognitive, affective, and psychomotor domains, to identify students' strengths and weaknesses, to improve teaching methods and curriculum design, to ensure competency in clinical practice, to provide feedback to students and teachers, to maintain educational standards in nursing practice. Characteristics: continuous process, not only at the end, both qualitative and quantitative, objective and systematic, based on learning objectives include theory and clinical practice. Performance. Types of evaluation: formative evaluation, summative evaluation, diagnostic evaluation. Formative evaluation conducted during learning, ongoing feedback. Summative evaluation conducted at the end of the instruction, final assessment. Diagnostic evaluation identifies learning difficulties before or during instruction. Domains assessed: cognitive domain, knowledge and understanding; affective domain, attitudes, values, professionalism; psychomotor domain, clinical skills and procedures. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Differences between assessment and evaluation. Differences between assessment and evaluation. Evaluation according to nursing education. Differences between assessment and evaluation according to nursing education. Differences between assessment and evaluation and evaluation according to nursing education. In nursing education, assessment and evaluation are closely related but serve different purposes in the teaching learning process. Assessment meaning systemic collection of information about students' learning progress. Evaluation judgment of the value or quality of learning based on assessment data. Assessment purpose to monitor and improve learning. Evaluation purpose to determine achievement of objective or competency. Assessment focus learning process. Evaluation focus learning outcome. Assessment timing continuous formative throughout teaching, evaluation, timing usually at the end summative of a unit or course. Assessment nature diagnostic and developmental evaluation, nature judgmental and decision making. Tools used assessment, observation, questioning, quizzes, assignment, clinical performance, checklist, evaluation, exam, final test, practical examination, grading systems. Aspect feedback. Assessment provides immediate feedback for improvement. Evaluation provides final results or grades. Assessment roles of aspect role of teachers. Assessment guide, facilitator, observer. Evaluation judge or decision maker. Aspect student improvement, involvement. Assessment active participation in learning improvement. Um, Evaluation से less direct involvement receives result. Very simple summary. Assessment how is the student learning? Evaluation how well did student achieve the goal? La ilaha illallah Muhammadur Rasulullah sallallahu alayhi wa sallam astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি পাশ করায় দেন। তারপরে আসেন স্ট্যাটিউটরি বডি। স্ট্যাটিউটরি বডি body according to nursing education. Statutory body according to nursing education. Statutory body according to statutory body according to nursing education. তা হচ্ছে in nursing education a statutory body refers to an organization or authority that is established by a specific law, act of parliament or government legislation and is given the legal power to regulate, supervise and standardize nursing education and practice. Key features created by law statute has legal authority, lays standards for nursing education and practice, controls registration, licensing and curriculum approval, ensures quality and professional regulation. In nursing context, a statutory body ensures that nursing schools follow approved curriculum, minimum standards of education are maintained. Nurses are properly registered and licensed. Professional conduct in regulated. Examples: Bangladesh Nursing and Midwifery Council regulates nursing education, licensing and professional standards in Bangladesh. Indian Nursing Council set standards for nursing education and training in India. Nursing and Midwifery Councils regulates nurse and midwives in the United Kingdom. In short, a statutory body in nursing education is a legal governing authority that maintains standards and controls nursing education and professional practice. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم أستغفر الله ربي من كل ذنب وأتوب إليه. Functions of statutory body. Functions of statutory body. Functions of statutory body. Functions of statutory body. Of statutory body according to nursing education. Functions of statutory body according to nursing education. According to nursing education. In nursing education, a statutory body such as Nursing Council or Nursing and Midwifery Council is an authorized legal organization established by law or regulate nursing education and practice. For example, the Bangladesh Nursing and Midwifery Council or similar national nursing councils perform the following key functions. Functions of statutory body in nursing education. Regulation of nursing education. Set standards on for nursing schools and colleges. Approves and recognizes nursing educational institution. Ensures quality of curriculum and teaching methods. Curriculum development. Designs and updates nursing syllabi. Ensure curriculum meets healthcare needs and international standards, introduce new competencies based on evolving healthcare practices, accreditation and inspection, inspect nursing institution regularly, grants or withdraws accreditation, ensures compliance with minimum educational standards, registration and licensing, registers qualified nurses and midwives, issues license to practice nursing legally, maintains a professional registry, examination control, conduct standardized nursing examination, ensures fairness, transparency and uniform assessment, declares result and certificate graduates, professional discipline, maintains ethics standard in nursing practice, investigates professional misconduct, takes disciplinary action when required, quality assurance, monitors teaching quality and clinical training, ensures competency-based education, improves patient safety through better training standards, continuing education and development, promotes in-service education and CPD, continuing professional development, enlarges lifelong learning for nurses, policy advisory role, advises government on nursing education and workforce planning, contributes to health policy development. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah Rabbi min kulli dhanbi wa atubu ilayh. হ্যাঁ আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। উম, এরপরে আসেন হয়ে গেল case study according to nursing education. Case study case study according to nursing education. Case study according to nursing education. In nursing education, a case study is a learner-centered teaching learning method in which students analyze a real or simulated clinical situation to identify problems, apply theoretical knowledge and purpose, propose appropriate nursing interventions. It is widely used to develop clinical reasoning, decision making, and problem solving skills in nursing students. Definition: a case study method in an in-depth examination of a patient scenario, real or hypothetical, that requires learners to assess data, identifying nursing problems and plan evidence-based care. Characteristics: based on realistic clinical situation, integrates theory with practice, encourage active student participation, focuses on problem solving and critical thinking, usually includes patient history, assessment findings, diagnosis and management. Steps in case study method: selection of a case, choose a relevant clinical case, example postpartum hemorrhage, pneumonia, diabetes, data collection, history, physical examination, investigation, problem identification, nursing diagnosis is based on assessment, analysis of case, interpretation of signs, symptoms and causes, planning care, nursing care plan, goals, intervention, rationales, implementation, suggested or actual nursing interventions. Evaluation: assess outcomes and effectiveness of care. Advantages: develops critical thinking and clinical judgment, bridges theory and clinical practice, improves communication skills, enhances decision making ability, encourages self directed learning. Limitation: time consuming, may not represent all clinical situations, requires skilled teacher facilitation, depends on quality of case presentation. Use in nursing education: clinical teaching involves community health nursing cases, midwifery case analysis, exam based problem solving questions. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam, astaghfirullah rabbi min kulli dhanbin wa atubu ilayh. আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশি উদ্দেশ্যে, আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Consequences of case study as a method of teaching according to nursing education. Consequences of case study according to nursing education. Consequences of case study according to nursing education. Consequences. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam, astaghfirullah rabbi min kulli dhanbin wa atubu ilayh. In nursing education, a case study is a powerful teaching learning method, but it also has certain consequences, both positive outcomes and limitation on students, teachers, and learning process. Positive consequences: the development of clinical reasoning, strengthen analytical and critical thinking skills, improves ability to interpret patient data and symptoms systematically. Integration of theory with practice, bridges classroom knowledge with real clinical situations, enhances application of nursing concepts in patient care, improve decision-making ability, encourages evidence-based clinical judgments, help the student prioritize nursing intervention, increased retention of knowledge, Learning through real-life case improves memory and recall. Development of problem-solving skills. Students learn to identify problem, analyze causes, and propose solutions. Communication and documentation skills enhances case presentation, reporting, and nursing documentation abilities. Professional confidence, exposure to real or simulated case increases self-confidence in clinical settings. Negative consequences or limitations. Time-consuming process requires significant time for analysis, discussion, and presentation. Requires skilled facilitation. Effectiveness depends on teachers' expertise in guiding discussion. Limited generalization of one case may not represent all clinical situation. Risk of incomplete learning if poorly selected cases may not cover all learning objectives. Student dependency issues. Some students may rely heavily on group discussion instead of independent thinking. A resource limitation. Need access to detailed patient data, records, or simulation tools. Educational impact summary. Overall case study method products deep practice-oriented learning, but its effectiveness depends on proper case selection, structured guidance, and adequate time allocation. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah rabbi min kulli dhanbin wa atubu ilayh. আয় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশি উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। আয় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দেন। এরপরে আসেন টাস্ক অ্যানালাইসিস। Analysis according to nursing education. Task analysis according to nursing education. Analysis according to task analysis in nursing education refers to a systematic process of breaking down a clinical or educational into smaller logical or sequential components to ensure effective teaching and learning. Definition. Task analysis is the process of identifying and organizing all the steps, knowledge, skills, and attitudes required to perform the nursing procedure actively, correctly, and safely. Purpose in nursing education to simplify complex nursing procedures into manageable steps, to ensure accurate skill acquisition by students, to identify learning needs and prerequisite knowledge, to improve patient safety by standardizing procedures, to assist in developing teaching plans and checklists. Component of task analysis. Overall task identification, example, administer intramuscular injection, step-by-step breakdown, hand hygiene, patient identification, medication preparation, site selection, injection technique, disposal of equipment, documentation, required knowledge, anatomy and physiology, drug doses, calculation, infection control principles, required skills, aseptic technique, communication with patient, clinical judgment, required attitude, responsibility, accuracy, patient safety awareness, importance, enhances structured clinical teaching, reduces procedural errors, supports competency-based education, help instructor evaluate student performance objectively if needed. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah rabbi min kulli dhanbin wa atubu ilayh. Purposes of task analysis.